Good morning, wherever you are. This is Tumor Crusher from ConferenceHype. Our segment will focus on physician-modified endograft total endovascular versus open repair of degenerative thoracoabdominal aortic aneurysms. From the 2026 May edition of the Annals of Thoracic Surgery, background fenestrated branched endovascular aortic repair is emerging as the preferred option for repair of degenerative thoracoabdominal aortic aneurysms. Methods: patients undergoing open repair or FBEVAR of degenerative TAAA at a single institution between 2005 and 2024 were included. Results: a total of 178 patients were included. Discussion: in this propensity-matched comparison of open repair versus FBEVAR of degenerative TAAA, FBEVAR using PMEGs outside of a physician-sponsored investigational device exemption trial was feasible and associated with comparable early and late outcomes, as well as shorter length of stay. From the 2026 May edition of the Annals of Thoracic Surgery, background: we intended to identify whether the lateral tunnel and extracardiac conduit fontan provide similar short-term outcomes in contemporary data. Methods: patients in the Society of Thoracic Surgeons Congenital Heart Surgery database who underwent a primary LT or ECC from 2012 to 2022 were included. Results: there were 11,429 fontan procedures performed in 133 centers, 2012 LT and 9417 ECC. Discussion: the LT fontan has similar mortality and lower short-term complication rates than the ECC fontan, but the latter has become the most frequently performed technique. From the 2026 May edition of the Annals of Thoracic Surgery, background: recent advances in transcatheter valve techniques often compete with open cardiac operations in managing high-risk patients with valvular disease, especially in the elderly. Methods: we identified octogenarians who underwent cardiac valve operations between 2004 and 2023. Results: a total of 934 octogenarians had valve reoperations. Discussion: repeated valve surgery in octogenarians can be performed with excellent short and long-term outcomes. From the 2026 May edition of the Annals of Thoracic Surgery, background: limited research has objectively assessed perioperative outcomes of tubeless thoracic surgery. Methods: of 337 patients, 263 were enrolled and instructed to wear a wearable device and complete EPRO's results. After PSM, 80 patients were included in each group. Discussion: we validated a multimodal digital platform for perioperative assessment. This is Conference Hype. Stay with us, coverage continues. From the 2026 May edition of the Annals of Thoracic Surgery, background: the Veterans Health Administration provides lung transplant care in collaboration with select academic centers, requiring travel and a shared care model. Methods: from January 2006 to March 2020, 31,302 adults were waitlisted, and 25,790 received transplants in the Organ Procurement and Transplantation Network Lung Transplant Database. Results: 1-year waitlist survival of veterans versus non-veterans was 83% versus 80%, with survival of veterans waitlisted at 5A versus non-5A programs of 80% versus 85% at 0.75 year. Discussion: survival from both the time of listing and transplant for all veterans and veterans treated through the 5A lung transplant program is at least comparable to outcomes through non-A programs, suggesting that the 5A program facilitates quality care for its patients. From the 2026 May edition of the Annals of Thoracic Surgery, Background: this study evaluates the feasibility and short-term outcomes of minimally invasive electroseptal myectomy for hypertrophic obstructive cardiomyopathy performed through a right infraaxillary incision. Methods: a retrospective observational study was conducted at a single center, enrolling consecutive patients diagnosed with HOCM between November 2023 and May 2024 who underwent MESM. Results: the cohort comprised 100 patients. Discussion: MESM through a right infraaxillary incision represents a feasible, safe, and effective approach for HOCM management, offering significant hemodynamic improvement with minimal complication. From the 2026 Jul 25 edition of the Annals of Thoracic Surgery. Background: the optimal timing of chemotherapy and multimodal treatment for pleural mesothelioma remains unclear. Methods: we retrospectively reviewed patients with resectable pleural mesothelioma who underwent NAC followed by pleurectomy/decortication with macroscopic complete resection between January 2012 and December 2024. Results: among 275 patients who achieved macroscopic complete resection, 273 were analyzed after excluding two 30-day postoperative deaths. 196 received AC, and 77 did not. Discussion: postoperative AC following NAC and pleurectomy/decortication may improve survival in pleural mesothelioma, particularly in patients with IP stage 1B or higher disease. From the 2026 May edition of the Annals of Thoracic Surgery. Background: although collected by the Society of Thoracic Surgeons Congenital Heart Surgery Database since 2013, the value of procedure-specific factors in improving our understanding of expected mortality has not been studied. Methods: included were benchmark operations for which PSFs are captured across 115 United States centers. Results: among 37,282 included BMOs, overall operative mortality was 2.6%. Discussion: incorporating PSFs into expected mortality models improved model discrimination for some BMOs, and certain PSFs had an important impact on mortality estimates, whereas others did not.
This is ConferenceHype. Stay with us, coverage continues.
ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. From the 2026 May edition of the Annals of Thoracic Surgery. Background: this study investigated the oncologic role of the ground glass opacity component in lymph node dissection for clinical stage 1, a solid predominant hypometabolic lung adenocarcinoma with a low maximum standardized uptake value. Methods: the study retrospectively reviewed 192 patients who underwent anatomic lung resection for C-stage IA2 to IA3 solid predominant lung adenocarcinomas with hypometabolic activity between 2008 and 2017. Results: the median follow-up duration was 108.3 months. Discussion: lymph node dissection is warranted in C-stage IA2 to IA3 lung adenocarcinoma with a pure solid appearance, even with hypometabolic activity. From the 2026 May edition of the Annals of Thoracic Surgery. Background: clinical lung cancer staging plays an integral role in determining surgical candidacy for patients with non-small cell lung cancer. Methods: a 24-item survey was developed and distributed to surgeons participating in the Society of Thoracic Surgeons email list. Results: the survey was sent to 1,336 individuals, opened by 653, and completed by 165, for an overall 12.4% response rate. Discussion: This study documented significant variation in how surgeons define bulky lymphadenopathy and its influence on treatment decisions, and highlighted the need for standardized definitions. From the 2026 JUL 24 edition of the Annals of Thoracic Surgery. Background: breast cancer is the most common malignancy among U.S. methods. A retrospective cohort study of women diagnosed with breast cancer from 2021 was conducted within Kaiser Permanente, Northern California. Results: among 42,290 women followed for a median of 4.6 years, 324 developed lung cancer. Discussion: Lung cancer risk among breast cancer survivors has increased over time, however, risk was driven by patient-level factors rather than breast cancer treatment exposures. From the 2026 JUN edition of the Annals of Thoracic Surgery. Background: timing and patient selection for Fontan palliation in single ventricle congenital heart disease remain subjects of debate. Methods: a retrospective cohort study was conducted on patients undergoing extracardiac conduit Fontan palliation between 1998 and 2021. Results: preoperative hemodynamics were comparable between the groups. Discussion: Fontan palliation can be safely performed in select patients weighing 12 kg, a finding supporting a strategy based on anatomic and physiologic variables over a strict weight threshold.
This is ConferenceHype. Stay with us, coverage continues.
That's it for now for Conference Hype's coverage of the June 2026 issue of the Annals of Thoracic Surgery. If anything was missed, tell us which article deserves follow-up. Tag us on X. Add your perspective in the comments, share this review with your clinical team, like the video, and subscribe with notifications turned on for the next journal broadcast.